A small hip shift in a squat is normal, and in some cases, even a big hip shift can be performance enhancing. But a consistent large hip shift can often limit performance or contribute to pain. And it's for this reason that you'll see many out there prescribing exercises like clamshells or band walks to strengthen the glutes as a potential fix. And while working on glute strength can help sometimes, it just as often fails. And the worst part is that in some cases, glute work not only fails, but also can make the hip shift worse. So in this video, we'll reveal why glute strengthening fails, explain the real cause of a hip shift, and give you the exercises to fix it. So without further ado, let's go ahead and jump right in. During a squat, we tend to see a hip shift in the bottom position. It'll look like this big movement of the pelvis towards one side, and this usually occurs as the pelvis moves away from a knee that's deviating too far inwards into adduction. Now, this is quite the deviation from the normal biomechanics that we should see. And this inward movement of the leg is the reason that many often attempt to fix it by strengthening the glutes, which do the opposite movement of abduction. But to understand why this fails, we need to understand the normal biomechanics of a squat. In an ideal squat, the pelvis moves into anterior tilt with the hips, knees, and ankles all maintaining alignment throughout. The anterior tilt on top of the legs is hip flexion. Hip flexion is a position where the ball of the upper leg bone glides back in the socket of the pelvis. Now, when this occurs, the back of the joint is going to open relative to the front. This joint position allows two things. First of all, it allows us the mobility to get into the bottom position, and second, it creates stability, giving us a solid position to push from. But when we fail to be able to access this position, we'll often see a compensation, and hip shifting is one of those compensations. In the case of a hip shift, the lack of anterior pelvic tilt on one side leaves the joint in a more open position in the front relative to the back. In this case, the ball is going to fail to glide back in the joint, and the body will compensate by moving the leg into adduction to take up that space in the front of the joint. You can see here, if I move the leg into adduction, it does close the front of the joint, and relatively speaking, will open up the back. But again, in this case, it's doing this through adduction of the leg relative to the pelvis, rather than anterior tilt of the pelvis relative to the leg. And the consequence is that adduction causes the pelvis to shift away from that leg. And it's this shifting away from that leg that creates the hip shift in the first place. Now again, both leg adduction and anterior pelvic tilt create stability between the pelvis and the leg. But, as we just described, there's a difference between how that happens. And the biggest difference is really the plane of motion. Both shift the ball back, but anterior pelvic tilt is a forward and backward motion, whereas adduction is a side-to-side motion. Forward and back motion purely is going to allow us to keep hips, knees, and ankles in alignment. But this adduction position is going to cause the pelvis to move in the side-to-side or rotational planes, which is going to disrupt the alignment of both legs. This disruption in the alignment of both legs changes the pressure from the ground up and can make it harder to bend one or both sides. Now again, in isolation, just a few reps, this isn't likely an issue. But with increased training intensity and/or volume, the likelihood of discomfort is going to increase. Now again, the glute strengthening perspective sees this adduction movement as evidence of glute weakness. They think they're going to use abduction to counteract this movement into adduction. But this is rarely the cause. In most cases, it's the position of the pelvis and the lack of joint stability that then encourages adduction. And so when we think about this stable position being one of anterior pelvic tilt, now we can start to see why glute exercises not only don't work, but might make it worse. Glute exercises are going to tend to work on hip extension and posterior tilt, and then abduction and external rotation. And again, while this can work to strengthen the glutes, it's going to reinforce that open position of the joint. Remember, posterior pelvic tilt and extension is going to open the front of the joint relative to the back, which is the opposite of anterior tilt. It's going to close the front of the joint and open the back. And this is the reason that glute strengthening fails. The mistake is looking at adduction in isolation without considering why it's happening in the first place. And so again, in most cases, with adequate anterior pelvic tilt, the leg doesn't have to adduct because you're achieving that stable joint position. So to address this issue, we must restore the ability of the pelvis to move on top of the leg into anterior tilt. This is going to allow us to achieve a symmetrical and stable joint position on both sides. Now, the best and easiest way to get started is to use something constrained like this back-to-wall closed chain hip flexion exercise that I feature in my lower body foundations program. This is going to help to isolate the specific mechanics of anterior pelvic tilt on top of the femur. To do this, we'll get the back to the wall, moving the feet about a foot away from the wall with a slight bend in the knee. Then keeping the leg more or less straight throughout, we're gonna reach up the wall with the top part of the pelvis, coming into that anterior pelvic tilt on top of the legs. We can do this for a number of repetitions, really isolating the feeling of the pelvis moving into anterior tilt. Now, as we do this, we can either maintain a parallel position in the feet and legs, or we can slightly toe out or change the width from more narrow to wide. I'd suggest that you play around with this a little bit and choose the stance that most directly translates to what you're going to use when you get into the squat. Now, once we get the feel of the pelvis moving on top of the legs, we can go away from the wall and use something like a good morning transitioning into a Kang squat to begin to integrate these skills. So again, as we get into this position, we might play with the degree of toe out or the stance width of being more narrow or more wide. Once we have that comfortable stance, we're going to start off by performing the good morning. We're going to shift back with the hips, once again feeling what we just did on the wall translate into this less constrained variation. And then once we have the feel of that and we're confident that we can feel the pelvis moving on top of the legs, then we can bend the legs at the hips, knees, and ankles, coming down into the bottom of a squat, transitioning this good morning into a full-on Kang squat. Now, once we have the feel of this, we can take this and integrate this right into our squat day. I'd actually recommend you use these first two exercises as warm-ups if you're having trouble with anterior pelvic tilt. Now, if you're not feeling super confident going right into your squat, you can use something like a box squat to constrain your depth. You're going to work down week by week, going only as low as you can without shifting the hips. Over time, you'll be able to take the box away completely and be able to do a full squat without a hip shift. Now, if you're struggling a little bit with these initial variations, or you want to dive deeper and truly understand how to restore all the biomechanics of the lower body, then consider picking up my Lower Body Foundations program. We have an entire series in that program dedicated to restoring the mechanics of the anterior pelvic tilt, and we have many other exercises that will restore all of the lower body biomechanics you need to move, feel, and perform your best. So that about does it for this video. Thanks so much, as always, for watching. If you're not already subscribed to the channel, go ahead and do that. Like this video, leave me questions down below in the comments, do all the things that help the algorithm to help us help more people. And until next time, peace.